Hi, my name is Kwek. I'm a pharmacist. Today I'm breaking down the medication Losartan. I'll cover what the medication is used for, how it works in your body, how to take it correctly, what side effects to watch out for, especially those that you should never ignore, as well as some important safety tips and precautions. As always, this review is for informational purposes only. Please do not start, stop, or change any of your medication regimen without first talking to your doctor. So let's start with the basics. What is Losartan? Well, Losartan, often sold under the brand name Koza, is a medication primarily used to treat high blood pressure. It helps protect the kidneys in people with diabetes and can be used in people with heart failure or stroke. Losartan belongs to a class of medications called ARBs, or the 4-angiotensin 2 receptor blockers. Now, we'll talk more about how it works in just a moment. But first, let's talk about what Losartan is used for. Losartan is FDA approved for high blood pressure, what I call hypertension, where it helps reduce the risk of stroke and heart attack. Losartan may also be prescribed for kidney protection in people with type 2 diabetes, especially when there's protein in the urine, something we call proteinuria. Now, Losartan may also be prescribed for people with heart failure. It may be used when other treatments are not enough, or it may be used as part of a combination therapy. Losartan may also be used for stroke risk reduction in patients with high blood pressure and an enlarged heart. Now let's talk about how Losartan works. Now, the human body produces a hormone called angiotensin 2, which plays a crucial role in regulating blood pressure by constricting blood vessels. Now, this narrowing effect leads to an increase in blood pressure, putting additional strain on the heart. Losartan targets this process by blocking the receptors for angiotensin 2. So, in other words, even though your body is still producing this hormone, the site where this hormone would have gone to sit and exert its effect is blocked. By doing so, Losartan facilitates the relaxation and widening of the blood vessels, allowing for improved blood flow. This not only lowers blood pressure, but also reduces the workload on the heart, making it easier for this essential organ to pump blood throughout the body. Now let's look at how to take Losartan properly. Obviously, you don't want to take Losartan exactly as prescribed by your doctor, but generally it is taken once daily, though you may find some people taking it twice daily. Your doctor will typically start you on a lower dose, typically about 25 to 50 milligrams daily, and may be adjusted upwards based on your blood pressure response. Losartan may be taken with or without food, so whichever works best for your schedule, just go ahead and do it, but just stick to a routine. And talking about routines, try to take it at the same time each day to maintain steady levels in your body. If you miss a dose, take it as soon as you remember, but if it's almost time for your next dose, just skip the missed dose. Never double up to make up for a missed dose. Now let's look at some key safety tips and precautions. Now, before or while taking Losartan, keep these things particularly in mind. Number one is avoid potassium supplements or substitutes unless your doctor specifically tells you that it's okay to do so. This is because Losartan can raise potassium levels, which could be dangerous. So combining with other potassium supplements can raise your potassium levels out of the recommended range. Also, do well to tell your doctor if you have kidney disease, if you have liver problems, or if you have issues with dehydration. Now, if you become dehydrated from illness, excessive sweating, or not drinking enough fluids, Losartan's effect can become too strong and cause dangerous drops in your blood pressure. Also, if you're pregnant or planning to become pregnant, talk to your doctor. Losartan is not safe during pregnancy, especially in the second and the third trimesters. Another thing that you're going to see with most blood pressure medications, avoid alcohol. Alcohol can increase the blood pressure lowering effects and make you dizzy or lightheaded. Talking about that, also be careful when standing up, especially if you're just starting Losartan. The drop in blood pressure may make you feel dizzy, and for some people, it may lead to falls. Now, let's talk about some common side effects. Now, the good news about Losartan is that it's generally very well tolerated. Most people experience few or no side effects at all. However, like all medications, there definitely are some people who will experience maybe dizziness or lightheadedness, especially when you are standing up quickly, fatigue or feeling tired, back pain, diarrhea, stuffy or runny nose, muscle cramps or weakness are all relatively common side effects that are reported with Losartan. Now let's talk about some rare but serious side effects which are important to recognize so you can have a discussion with your doctor. So for example, if there is a severe allergic reaction which may be manifested like a rash, swelling of the face or throat, or difficulty breathing, that is something that you need to be reaching to your doctor about. Another potential serious side effect is high potassium, which we call hyperkalemia. The signs may include muscle weakness, irregular heart rhythms or heartbeat, or feeling like your heart is skipping. If you experience anything like that, pick up the phone and call your doctor. Another potential serious side effect is kidney problems, which may be manifested by changes in your urination or swelling in the legs or ankles. Also, fainting or severe dizziness, especially in older adults or people taking diuretics or what we normally call water pills. Now, if you notice any of these, please contact your doctor right away. It may not be anything, but it's better to be safe than sorry. Now, remember that it may take about 3 to 6 weeks or so to see full blood pressure lowering effect of Losartan. So do not quit taking your medication thinking that it is not working. Now, on the flip side also, if you've been taking Losartan for some time, do not stop taking it abruptly, as it may result in extremely elevated blood pressure for some people. Now, I sincerely hope you found some value in this video. If you did, please give it a thumbs up, stay blessed, and I'll catch you on the next video.